identified as from the COVID-19 virus. We currently in the state have about 340 people being monitored, and we have about 300 people who have completed their monitoring. And we are in the state of Vermont rapidly trying to react to the situations at hand. The governor's folks through the Emergency Operations Center are coordinating efforts across the state, from medical providers and medical circumstances to the conversations with economic development and the Agency of Economic Development for businesses, as well as for Vermonters who have been asked not to work, and providing the economic services for folks to be able to access unemployment. And there are a number of different folks across state government who are working on this effort throughout the state, literally 16, 18, 20 hours a day. And I know the administration's staff across many branches, from education, economic development, health, human services, pretty much every agency, Department of Motor Vehicles, are all working on trying to make this pandemic both get addressed and flatten the curve as quickly as possible, as well as work to provide services and answer questions for Vermonters. And as your Lieutenant Governor, I've been fielding many emails, calls, inquiries through social media, and through my office have been trying to direct people to the right location, as well as direct concerns, thoughts, ideas, and questions to the administrative officials who are most appropriate for helping Vermonters do the work on your behalf. I believe I'm going to roll now into the broader conversation to get started. As everyone probably has heard the term, our broadest goal is to flatten the curve. We are working hard to reduce the number of people that are getting infected through people becoming in close contact and spreading the contagion to others. And there are many reasons for that, and I will ask questions to the medical professionals to really talk about that in a moment. But I want to give a little context about how we got where we are at the moment, and then we'll get into this conversation. First, the governor and the administration had actually started monitoring this back in late December, as efforts, as examples of this were starting to spread in China. And more recently, as we all learned, the governor executed his first executive order on March 13th, declaring a state of emergency, which allowed for a number of measures to start to take effect. In particular, they closed nursing home and senior care and vulnerable facilities, were closed to visitation, and access was limited just for healthcare professionals. It was also the first moment that public gatherings were limited, and at that point it was 250 people or fewer. The Department of Motor Vehicles was asked to develop protocols for eliminating in-person visits. There were rules developed for telemedicine, and there were suspensions of the search for work requirement for folks to claim unemployment insurance. Things rapidly, as you know, have progressed. On the 15th, there was a directive that the schools would be closed on the 18th, as well as child care centers, and that they would be kept open for essential personnel. Much of this information can be found on the Department of Health website that you could then go to find out terms like essential personnel and so forth. The next day, gatherings were limited to 50 people or fewer. That was on March 16th. And also restaurants could no longer offer in-person meals, just takeout. On the 17th, another directive was put out relating to child care facilities being available for essential personnel, healthcare providers, custodial and kitchen staff, and folks working at federal qualified health centers, nursing homes, and other locations. On March 18th, another directive occurred under the executive order. The Department of Motor Vehicles would no longer have in-person contact. licenses and registrations renewals would be extended for 90 days, and a number of other measures were taken in that directive. On March 19th, alcoholic beverage takeout and delivery was allowed with the meal takeout. On the 20th, it was directed that there would be no more elective surgeries at our hospitals and that they were to prepare for larger scale instances of COVID-19. And on the 21st, non-essential gatherings are banned, gyms, small businesses, such as tattoo parlors and others like that, and group gatherings of 10 people or fewer were recommended. Throughout all of this, the goal has been, again, to reduce the spread of this ailment so that our hospitals will not get overloaded. On March 23rd, the directive was put out to work from home and that all non-essential businesses try to telecommute. And then now, as we just learned yesterday, the stay-at-home order was executed to really restrict the amount of human interaction that is happening. All of these can be found on the executive website, and you can find these through Google under Vermont Executive Orders, and you can read many more details on all of these. In detail, the stay-at-home order is basically to not leave home if possible, except for under necessary needs like groceries and pharmaceuticals and basic needs, to really restrict human interaction. And again, I'll rely on our medical professionals to discuss why that is so important. Finally, I want to give an update on the legislature that yesterday the legislature met. I was presiding over the Senate, and we passed 3 bills in order to address a range of items that could not be addressed through executive action. And I just signed those bills about an hour ago for them to go to the governor. Some has to do with local government allowing for teleconferencing and Australian ballots so that local government could continue to operate for public health. There were support measures for both workers and businesses so that workers who have to leave work immediately would not lose the opportunity for unemployment benefits for the first week of delay, that those would be available immediately, and that you would not have to do the search for work requirement. And also to protect employers with respect to getting added fees because of the unemployment claims, which is the normal practice, but that is being waived because obviously it wasn't the employer's fault that people are needing to seek those unemployment benefits. You can go to the website accd.vermont.gov for more details about that whole section of law, and how to gain those benefits and make sure you are able to pay your bills and get the resources you need to get through this. We also adjusted 2 other quick pieces of law around school buses. They are delivering meals and school work to thousands of students across the state, and those school buses are allowed to flash their lights when they are stopped to do those deliveries to protect those school workers and so the teachers and the drivers. So you are required to stop for those school buses. And then the one last piece that is very distressing for many, but very important, is that folks are now, of course, planning if the worst occurs. And we adjusted language around last wills and testament so that folks could work with their lawyers through telecommuting and witnesses to be able to execute those so that everybody is prepared for the worst. We are going to move on into our teleconference with, with Dr. Rice and Nurse Snell, and I'm going to turn it over, if I could, to Deb Snell to give us some introductory remarks.
Thank you, Lieutenant Governor. First of all, I really want to thank the community of Vermont for being so supportive of healthcare workers at this time. Like anyone else in the public right now, we have our own concerns and anxiety about what's going on, not only in the community, in our hospital, but our own families as well. So we share all of your concerns. So one of our big concerns, of course, is making sure that we have enough personal protective equipment to care for the patients that we're getting in the hospital. We're also concerned about the number of beds that we have available in the hospital. What we're hearing is that we're probably not going to see the peak of this in Vermont until, late April through May, possibly into early June. So as many people have said, this is not a sprint, it is a marathon. So everyone needs to pace themselves and become adjusted to our new dystopian society. We also at the hospital have, and I think several hospitals across the state now have the no visitor policy in effect, and we completely understand how difficult this is for everyone. But please understand that you're not only protecting yourselves and your loved one in the hospital, you're also helping to protect us, the healthcare workers that are staying at the bedside and doing this important work. That's why it's also important, if you're feeling any symptoms at all and you feel like you may have been exposed to COVID-19 or are fearful that you have been exposed to it, please call your primary care physician. Do not go to the emergency department. The primary care physicians are going to be able to screen you over the phone. They're going to be able to direct you where to go for a test if they feel a test is needed. It is so important right now that we do not clog our ERs and urgent cares with these patients. We need them for the truly sick who need to come into our facility. I'm not saying if you're having trouble breathing, of course, go to the emergency department, but if you're having just the cough, the cold, a fever, please just try to utilize your PCPs. Thank you.
Thank you, Deb. And before I introduce Dr. Rice, I just want to remind our listeners that a couple things. We hope to touch on many issues in our future town halls. And the best way to stay up to date on the recommendations and restrictions and access to resources is through the Vermont Department of Health website, which is healthvermont.gov. And their first and primary page is dedicated to the coronavirus. And if you don't have computer access, you can call 866-652-4636. I also want to remind you that if you have a question for our guests, please press 0 on your phone to be added to the queue. And next we're going to hear from Dr. Paul Rice. He's a medical doctor with Evergreen Medicine. And Dr. Rice, if you could offer us some thoughts, please.
Yes, thank you very much, Lieutenant Governor Zuckerman. I must imagine that most folks have had some opportunity, or their family or friends have had some opportunity to interact with the healthcare system. Things have really changed. We are doing the best we can to not have patients come to our office. As Deb Snell said, we do want to take care of patients here, though, who really shouldn't be in the emergency room. Your risk there is of catching this virus is probably greater than coming to our office. But as much as possible, we're trying to avoid anyone coming. If you do call your primary care office, which you should do if you have questions or concerns about your being sick, we will oftentimes want to encourage you to schedule a telehealth visit where we can actually see you, talk to you, get some sense of your degree of illness over the phone and video, and not really tie up our telephones with trying to answer all those extended questions. So we'll probably be encouraging you to schedule a televisit call. Basic general questions about the coronavirus, your risk, if you're not sick, for example. It would be good to go on the Department of Health, the CDC website, or other very reliable websites, and there's several of them. You do have to be careful about where you get your news, though, because there's some funky stuff going on out there, and you want it to be a reliable website to get answers to your common questions, to allay your anxieties. Let me say that most people who get the coronavirus have mild disease. We're currently doing drive-in testing at the office for our patients. We've had quite a few positive cases, and most of those folks are not that sick. but we need to know oftentimes what their status is because they're taking care of elderly parents, they're healthcare workers, they're immune compromised, etc. Those people who should be tested are those who have some significant risk or significant symptoms. We don't want to test at this point asymptomatic persons or persons who are relatively young with mild disease, because most of the time that disease is not going to be harmful to them. They should be quarantining themselves and not interacting with others. I think it's important to say too that the test, and this, people won't be happy with this, but the test sensitivity is not 100%. So if you have symptoms and you get tested, the sensitivity is 75 to 85%, meaning 15 to 25% of the time, the test may come back negative even though you have the virus. That's not too comforting, but it speaks to the need to continue isolation and good hygiene practices. If the test is positive, it's likely to be a true positive. It would be very unusual for that not to be a true positive. As Deb had said, call your primary care office for care. Many primary care offices will still see you for lacerations, non-respiratory illnesses like abdominal pain, evaluate you for chest pain that's unlikely to be your heart, those kind of things, oftentimes after doing a teleconference with you to evaluate whether you should come in. If you do come in, it requires you to wear a mask and for the practitioner wear personal protective equipment so that we don't take any chances. So it's a bit of an ordeal to have you come to the office, but we will do it if we do need to evaluate you in that way or do blood tests, for example. The most common symptoms are cough and fever. Virtually everyone who tests positive has cough, fever, or both. After that, fatigue, muscle ache, sore throat, sometimes GI symptoms like nausea and diarrhea. Not sneezing, that's more of an allergy or sort of simple cold type symptom. So mild symptoms or just sniffly nose and sneezing, unlikely to be the coronavirus. So that's my introduction, and we can certainly take calls about other approaches to it from a medical standpoint. But the more you can find out of reliable information, hopefully the less anxious you'll be. And it's important to keep that social distancing, good hand washing, and the fewer contacts you have with people or surfaces, the less likely you are to acquire it or to give it to others. Thank you.
Thank you, Paul. That is really helpful, and Deb, that was really helpful. We're going to open up our line for questions. Our first, and I just want to say we have a lot of questions lined up. It's great that folks, well, it's distressing that we have so many questions that we have to address, but thank you for coming in with all your questions, and please know that any questions that we don't get to by the end of the call, we will still work to get back to you with answers to those questions. Our first call is from Judith, and in particular from Rutland, and she has a question particularly for Dr. Rice. Judith.
I'm curious if there's any kind of parallel program of testing going on for people who feel that they've had it. My daughter, for example, in January exhibited these same symptoms, got over it. So now I'm curious if we can find people with antibodies who can then go back to work and help out industry.
Yeah, that's an excellent question. The question of when you're able to actually get back to work, even if you've had it, and how long are you contagious? We're still trying to figure out the answer to that question. It appears that folks who have had it can be contagious up to 2 weeks after their symptoms are gone. I mean, for the regular flu, for strep, for other things like that, we tend to say people can go back after 2 or 3 days of symptom resolution. But with this, it looks like people are shedding the virus for a considerable time after their symptoms are gone. We don't have a readily available test to do antibodies to see if somebody's had the coronavirus and whether they should stay out for longer because of it. That's not something we have available now. It's potentially something that could be available in the future. But for people who critically have to go back, there is the potential to retest them to see that they come out negative. However, having said that, I had already mentioned where the sensitivity of testing is not 100% either. So we're sort of stuck with having to isolate people for a little bit longer, just for a degree of caution.
Thank you. I really appreciate it. We have Hubin, I believe I'm pronouncing it right, I hope, from Essex, who's got a question for our folks.
Hello?
Hello.
Hello.
Welcome.
Yes, this is Ruben from Essex, and the question is for Dr. Rice, is what are the symptoms that are progressive symptoms that follow the initial symptoms of fever and cough that would be concerning, and that would be something that people need to know to be more concerned and go to a medical professional without waiting until they get bad.
And can I offer, along with Dr. Rice, Deb, working in the intensive care system, you might also have some insight on this as well. Go ahead, Doctor.
Hoban, I just would say that people present with lots of different symptom complexes, and it may not be the cough or the fever that they start with. They may actually start with a sore throat or a headache or just general malaise, and then the cough comes on. I think that the important thing is the severity of symptoms and the progression of symptoms over time. Sometimes they come over several days and people get worse. As I say, oftentimes people have mild illness that lasts quite a long time. Deb can probably address those folks who end up in the ICU or the emergency room, because the symptom I didn't mention that's not as common, but is probably one of the most important in terms of severity, is shortness of breath, trouble breathing. Deb?
Yeah, and especially those who have comorbidities like diabetes, COPD, high blood pressure. Any comorbidity can put you at a little bit higher risk for basically catching the coronavirus, the COVID-19. So those people should obviously be very, very careful, especially our immunocompromised population.
Thank you, Deb. Our next question is from Gail in Burlington, and she's got a question for, I think, either one of you who knows best on this one.
Yeah, my question is, as we're required to stay home with the exception of getting food, what are the big concern in grocery shopping is the exposure people have to the cashiers and the exposure their food has to other people. And my concern is that most cashiers don't know very much about sterile technique. And I witnessed yesterday or the day before, someone had gloves on, but she was handling money and food and not washing her hands in between and not washing down the counter in between clients. And I'm worried about them being exposed to the coronavirus and not having a mask on. I mean, it's very likely they might be carrying it for 2 weeks without a mask on and be passing it on to the customers in the store. And my question is if there's something that can be done to help the stores train their cashiers to take care of themselves and protect themselves and also protect the clients that are shopping for food.
Go ahead, Deb.
Yeah, thank you.
Well, in general protection, how does anybody protect themselves?
Yes, no, exactly. I mean, I know there are a number of stores, including the one right up the street from me, that is no longer accepting cash. They're only taking debit or credit cards. We can try to educate people the best we can to stay smart and safe in this. But your best bet is to always, carry your own hand sanitizer with you or your own wipes with you to like wipe down the debit machine and anything you may come in contact with. I know there's all kinds of sites that tell you how to keep your food safe and everything else. And, you know, I don't have a good answer for that, but if someone's not doing the right thing, that doesn't mean that you can't be doing it.
And so this is Dr. Rice. I would echo that and add that, you know, and I've been in a couple of stores recently, and I do feel sorry for the folks who have to work those front lines because they're exposed to a lot of folks all day long. Those gloves protect them because they can take them off at the end and throw them away, but they don't really protect you, and may actually be moving, you know, disease around from item to item, for example. Try to keep your distance from them, you know, stay back. Try not to interact with them in terms of handing things back and forth. Use that credit card machine by putting it in there like that, and then washing your hands afterwards. And then you sort of have to assert this virus can stay on surfaces. So the mail, you know, I don't want to scare folks, but the mail, the packages you bring home, all those kind of things, you just have to be somewhat careful with how you handle them and how you wash after handling packages that have been handled by lots of other people. And that's not the most common way to spread it. It's through the air. It would be good if there was enough protective equipment for those cashiers to wear face masks. And let me make a point about face masks. Face masks are pretty good for preventing the spread outward of disease. They're actually, unless they're a fit N95 respirator mask, they're not very good at preventing the acquisition of the virus into you. It protects other people from getting it from you, but it doesn't prevent you from getting it nearly as well. It may help some, but not nearly as well. But again, keep your distance, wash your hands frequently, even after touching doorknobs and shopping carts. You really should be doing that.
And it sounds like really to protect a lot of the grocery clerks and workers, while we're all trying to do social distancing and think about this whenever we're around other people, being hyper vigilant when you're in the stores to really give that space. I mean, if you want something maybe that they're stocking, ask them to step back so you can reach in. Don't just reach over their shoulder. And I think this is something we should all be thinking about when we're in any kind of setting with other people. If you stop to talk with someone, even if you're 6 feet away from them, if you're in a grocery aisle, maybe nobody else can walk by. So it's probably good to be as aware of your general surroundings and really with those clerks, whether it's the stockers in the store or the cashiers, really keeping that distance because they're getting exposed to so many of us every day. I'd like to take a moment before we get to our next question to briefly ask our listeners for some feedback about future telephone town halls. We are hoping to have a number of these as this progresses, and we've got a few options, and we'd also welcome other ideas if you want to submit them to my website, zuckermanforvt.com. So from the options I'm about to read, please select one topic you would most like our next telephone town hall to focus on. And I'll read through the 5 twice so that then you can touch which number for your answer. Press 1 if you would like to focus to be on the overall economic impacts of COVID-19 and how we will weather this crisis financially, individually, and as a state. Press 2 if you would like the focus to be on mental health and wellness. Press 3 if you would like the focus to be on education and homeschooling students. Press 4 if you would like the focus to be on rebuilding businesses in Vermont and how employers and employees move forward post-COVID-19. And press 5 if you would like the focus to be on food security and farming. I'm going to repeat that again more quickly, but press 1 if you would like the focus to be on the overall economic impacts of COVID-19 and how we weather the crisis. Press 2 if you would like the focus to be on mental health and wellness. Press 3 if you would like the focus to be on education and homeschooling. Press 4 if you'd like the focus to be on rebuilding businesses in Vermont and how employers and employees move forward post-COVID-19. And press 5 if you would like the focus to be on food security and farming. Again, if you have questions at any time, press 0 on your keypad, And if some of you, we don't get to your questions at the end, please stay on the line afterwards so we can keep those and then work to get back to you with some of those answers. So I'm going to go to our next question, which I believe is from Jeffrey. And if you could go ahead and ask your question.
Good. Hi, Jeffrey here. I guess two questions and points. I hope you'll all take in a good spirit. And the first is the number of tests. When first asked at the first state press conference, they didn't know. That is important because the evidence coming out and a study just done in Italy indicates that testing everybody, finding the asymptomatic people that test positive and isolating them, things like that are hugely beneficial to bending the curve dramatically downwards. And so we're all talking in the context of the constraints being put on us, but we don't have enough tests. And we need to start to advocate, okay, and fight to get the test. Two, the same thing applies to masks. I disagree with the comment that was made. Masks scientifically are dramatically huge in helping you not to get the virus. If everyone was wearing masks, that would have a huge impact. So we need to fight to get the mask, or start with people
Jeffrey,
in Vermont that can make the masks.
Thank you. And if we can, if we can keep it to questions, I appreciate the points. We'll be able to get to more. Doctor and Deb, would either of you like to address some of that?
I wouldn't mind talking about the mask. And then,
go ahead, Deb.
Go ahead, Deb.
No, I was just going to say, as you know, I'm someone who works in the ICU. Yes, we're using N95 masks currently, and I appreciate his comments, but you have to understand that with any mask other than like the N95, which is still itself not 100%, a lot of these masks are permeable. So when we're talking about airborne precautions or droplet precautions, which is how this is spread, not all masks are the same. And that's really important to understand. And Dr. Rice, please.
Yeah,
Dr. Rice, you there?
Yes, I am. So, I think a lot of well-meaning people are, talking about sewing cloth masks and fabric masks and whatnot. And that, again, that may help somewhat if you're coughing or sneezing from creating things to be airborne. But these are very small viral particles that are airborne. And when you're breathing through a mask, those virus particles are small enough they will come right through, many of those fabrics. So it's you're giving yourself a false sense of security by, I do agree with the caller that if everyone's wearing masks, it would help because then everyone isn't spreading it into the air. But don't be fooled that a mask is other than a fit 95 mask is going to prevent you from catching it. In terms of testing, because there was a question about testing, it is unfortunate, but we are limited in the throughput for testing. Even the health department has now moved most testing, as my understanding, to an outside laboratory. We started a couple weeks ago doing our drive-in testing using a commercial lab, outside laboratory. We're doing it just for our patients in our practice that we feel need it. When we first did it, we got the results back in just over 24 hours. The results from the second day took almost 4 days to come back. So the throughput is being hampered by the number of tests. And they're rapidly gearing up to do more. And I'm hopeful that at some point we'll be able to test everyone with mild illness or even asymptomatic contacts of people who have been positive, so that we can get a real handle on this. But unfortunately, we don't have that capacity at this point. I hope that helps.
Thank you. We will take another question. I've got Anna from Essex. You've got a question. Go ahead.
Hi. I'm calling with a question about unemployment. People who are self-employed don't qualify for unemployment. And Vermont has so many of us. I'm wondering if there's anything coming along for us.
Well, absolutely. I guess I'll take this one. It's not quite in the healthcare arena, other than, of course, if people don't have money, they're not going to be able to pay their bills and get their food and keep their house warm. So it's very much related. My understanding is that at the federal level, the massive, almost $2 trillion bill is got a lot of money included to help those who are self-employed, run their own businesses, or are individual contractors. And for those that aren't familiar, I think this question is in part because some people may not know that not everybody pays into the unemployment insurance fund. That is something that businesses pay into so that when their employees are unemployed for some reason, they have access to get resources. But for a lot of independent contractors and folks who have their own self-employment businesses, they don't pay in, but it also means they're ineligible to receive those funds. But again, my understanding is in the federal bill, and I heard Congressman Welch talk about that today, there is a lot of attention paid to this issue. And so I would direct you to maybe call our federal delegation exactly how that's going to work. But there is a tremendous focus and effort trying to be made in that arena as the state and federal governments try to work together to make sure people don't slip through the cracks. Thank you, Anna. I want to remind people that you can dial 0 for any more questions to please do so, and we'll enter those in through our callers, call screeners. And then I want to briefly give the results to the earlier poll that asked the different topics you'd be interested in. 30% of our dialers in said the overall economic impact of COVID-19 and how we weather this crisis financially and individually as a state, and 29% wanted to talk about food security and farming, and the next was 23% mental health and wellness, followed by 14% the discussion of rebuilding business in Vermont and how employers and employees move forward, and 4% wanted to talk about education and homeschooling students. This is really helpful to us. We will work to use these priorities as we develop our next programs. And our next question is going to be from Ron in North Troy, Vermont. Welcome, Ron. You've got a question.
Hi, David. Question about vehicle inspections. I know we've delayed most of the DMV requirements, but vehicle inspections haven't been addressed. Is that being considered?
I will have to reach out to the Department of Motor Vehicles. I believe in the most recent executive orders and prior parts of the executive order, there was some work done on those measures around vehicle registrations, and I believe possibly inspections as well being allowed to be delayed 90 days. But that is something that we will have to look into. So if you can leave your contact information with our caller takers, we can make sure to get back to you with that answer. I apologize for not knowing every answer, but I believe that is going to be addressed, again, out of safety issues. We have another question. This question is from Peter. Peter, why don't you go ahead and offer your question? Hello, Peter. Are you there?
Yes.
There we go. Go ahead and ask your question.
Okay, my question was, we came home from Florida, and we took the outer train to Virginia and drove the rest of the way. Made it as fast as we could. When do we start counting the 14-day whatever you want to call it? When you're
quarantine?
Yeah, the quarantine, the 14-day quarantine. And that's part of my question. The second is, I went into Shaw's this morning to do some shopping that badly needed. And does that put me back to day one because I was with other people or around other people? And then it was supposed to be a seniors only, and there were more young people than seniors by far. And I asked someone about that, and they said yes, that was supposed to be seniors, but it was not enforceable. Is there anything that can be done about that?
A couple things. I think the stores are doing those hours for seniors voluntarily and in their own capacity. As far as I know, that's not a state-directed mandate, so there's, I believe, little enforcement, unfortunately. I think we have to ask all of our citizens in Vermont to really try to pull together and work together to help reduce the risk for other folks, as particularly seniors and those who are vulnerable. So that is something that I will pass on to the governor and his staff with respect to whether or not that should be something that is more of a mandate from the state to make sure seniors and those who are vulnerable are more protected and able to go in the stores first after they've been thoroughly cleaned and restocked, with therefore hopefully less exposure to virus on surfaces, et cetera, throughout the store later in the day. Doctor or Deb Snell, do either of you have thoughts on the quarantining period?
Well, it's Dr. Rice here. I think that the quarantining is really meant for folks who are coming from high-risk areas with a high number of coronavirus cases, as specifically places originally China, Italy, obviously, and other places potentially in the United States that have very high coronavirus. That would be places like New York or Washington State. If you were coming from Florida on a train and you didn't have particular contact with positive coronavirus patients, those folks who are moving around within the United States, there isn't a particular recommendation for you to be quarantined for 14 days. So you don't have to do that unless you're coming from a very high risk situation overseas, or if you're truly coming from a high risk situation within the United States, it probably would be a good idea. But I don't believe we have those restrictions currently.
No, we don't. And I would also add, at some point, any travel in the U.S. might be considered high risk. At some point, even coming to Vermont may be considered high risk. So I think they are looking at changing the travel recommendations in the near future.
Thank you, Deb. I want to make one other point before we continue on with the questions. We'll be taking some more in a minute. I want to, before we get to the end and too close to the end, thank everyone who's listening and asking questions. This has been really helpful for me, and I hope others. I want to continue to make this kind of telephone town hall available for folks to connect and update you all, Vermonters, during the crisis and those topics that we just had the poll about. I do want to ask, if you are able and willing to make a contribution toward a future telephone town hall, please press 1, and my team will be in touch with you soon after the program, and that way we will be able to continue these telephone town halls. So press 1 on your phone pad if you're willing to help fund these telephone town halls so that we can keep making this information available. My next question is from Karen, and it's if you could come on the line, we'll take your question.
Hi, good afternoon. I'm just wondering if my husband, for example, is 70, almost 70, and he stayed home voluntarily from work because I'm more high risk, and he wanted to protect me. We were not able to get unemployment because it wasn't an official layoff. Is there going to be some relief for him so that he could file if he wanted to for that?
I'm quite certain that he is eligible because people are allowed for unemployment insurance whether you've been required to leave work or left work for health concerns around COVID-19. And certainly with what sounds like the age situation here, I believe that would qualify. Please go to the Agency of Community Development website, accd.vermont.gov, for more information, but also you can call my Lieutenant Governor's office and 828-2226, and we can try to help you get access to that information and access to that financial support. Our next, sorry, I'm going to give the number once again for folks for my Lieutenant Governor's office just to make sure, 828-2226. If the next question is from Judith from Marshfield, and please go ahead with your question.
Hi, this is Judith in Marshfield. I am hoping, and you can tell me if this is happening, that the state of Vermont, and particularly our health department, are already discussing increasing the medical facilities to get ready for a big crunch in the disease rate, which may be coming at us. I think we need to increase the facilities and talk about ways to staff more facilities, as well as, of course, get more protective equipment for the healthcare workers. Thanks.
Sure. I would say, yeah, Deb, go right ahead with this if you could.
Yeah, no, I do know that the National Guard is doing setups across the state. I believe one in St. Johnsbury, one in Barrie, and one in Burlington. I think they're using over at Gutterson at UVM, I believe. So that is all in play. They are bringing in crisis nurses into the state to help because we potentially could have a shortage of nurses if we have a large group fall ill as well. So there are a lot of plans in place from the hospital perspective about trying to beef everything up and increase the number.
Doctor, do you have any thoughts on that? If not, I can offer one little bit. I will offer that the legislation that just passed and the governor's work are making it possible for folks who have retired, medical professionals who have retired in the last 3 years, will be eligible to work in the medical system if they so choose. That also includes medical professionals who either move here or come here, obviously as long as they are not infected or potential risks. So we are working to make those folks who maybe left the medical field, either retiring with age or retiring to go on to some other practice, eligible to help. We've also stopped all elective surgeries in the hospitals, and my understanding is there's around 500 rooms available across the state that are a far greater number than would normally be available as more patients are coming in. So the state is taking measures and the hospitals are taking measures to be prepared. They've stockpiled, I heard on the radio today, about 75 or 80,000 masks. That may sound like a lot of masks, but obviously each nurse and each medical professional and provider will go through many masks a day. I've also talked with the Department of Health, and my understanding is that early next week, shipments from both FEMA and potentially actually from China are going to be coming in to the country and to the state to resupply our hospitals and medical providers with more personal protection equipment. But it is something that if anybody has extras, as we had some on the farm, we're donating those to the hospital. I know a lot of construction companies have donated many to the hospitals as well in order to try to make sure our medical providers have as much safety equipment as possible. I think we're going to take one more, or maybe two more questions. We have Jody from South Royalton. If you'd care to offer your question, please.
Hi. So my question is regarding Vermont Student Corporation, the VSAC. I'm sure maybe a lot of people have a lot of student loans with them. So we had got notified that that they were going to defer or do interest only. So I gave a call yesterday, and so my question is, they told me that they can help with federal, but that's it. And so my private loan is, I'm out of luck. They don't know what to tell me, and that they would go through the same process if I can't pay. I did lose my job with COVID, and so I'm trying to put the question to you guys about what is going to happen. It's a Vermont-based program. It's supposed to help Vermont students. How are we going to address this? And, what for? I know that things are just going to get worse, obviously.
Right. I think you're absolutely right. Things are going to get worse before they get better. And with that in mind, I hope folks recognize that if we take stronger measures now to really flatten the curve and reduce the rate of exposure and infection, that will give more time for vaccine to be developed and protocols to be developed so that we can get our economy back up and running so that folks won't be left without incomes for as long as may be necessary if people don't all take, hopefully, helpful protective actions for yourselves and for your neighbors. With respect to VSAC, I would ask you to please call my Lieutenant Governor line, and so that we can follow up with Vermont Student Assistance Corp with respect to the VSAC loans and the federal loans. I know there is a lot of support being developed for those situations, but also I've been getting a lot of questions from folks like yourself about the private sector loans, and we are exploring what options are available to try to mitigate the challenge that folks like yourself are going to face with those loans, but I have not gotten the most recent update on what is possible, and I'd like to be able to follow up with you if you could. That number was 828-2226, and I apologize for not having more clarity for you in this moment. We've been fielding a lot of questions over every day, and unfortunately I don't have every answer at the tip of my tongue, but thank you for the question. I think we'll take one more question from Catherine from Thetford. Catherine.
Yes, I'm wondering what the doctors in Vermont are learning from treatment protocols for COVID-19 that have been used by doctors in China, and especially herbal remedies that have been found to be effective there, and also infusions of vitamin C. I've heard that vitamin C can make it possible for a patient experiencing breathing difficulties not to need a ventilator.
From my standpoint as a primary care physician, we don't really have anything at our disposal to assist with the patients we are seeing who mostly have mild illness. There's some suggestion that some medications have been around for a while, might have some usefulness, and there are studies ongoing for that. But as yet, that's very small case studies, and much more information is needed before that becomes widespread. I'm not familiar with vitamin C or other herbals, and again, I'm not taking care of the sickest patients that really need aggressive treatment. For most of these viral illnesses like this and influenza, it's supportive, oxygen and hydration and that kind of thing. Deb, do you have a sense of what's being used in the ICU?
So, again, it's supportive measures. We have used vitamin C in our ICU, but those are mostly for what we call our septic patients who have overwhelming infections. But again, COVID-19 is viral. It's not bacterial. So there's no quick fix or antibiotics to treat this. It really is, unfortunately, just fighting it out. Or for those patients who get sick and end up with me, just providing all the measures that we can to get them through it.
Well, thank you. I want to offer a brief thought that we will offer for everyone and get a closing statement from Nurse Deb and Dr. Rice, and then give some closing thoughts myself about what we can all do. I want to invite our listeners to visit my website for updates on COVID-19 in Vermont. You can visit Zuckerman4VT.com. That's Zuckerman, FORVT.com. The first thing that will come up is updates on COVID-19 and where to get more information. If you want to receive updates on the campaign in general, including the upcoming telephone town halls that you just prioritized for us and other virtual events, you should click on the Get Involved link to sign up for our email newsletter. And I certainly want to thank our guest speakers and now give you a chance to offer some final thoughts. As I'm sure I can speak on behalf of everybody across the state, we are incredibly appreciative of all of you medical professionals. You're supporting Vermonters on the front line during this crisis, putting yourselves at risk, and we are all incredibly thankful for the work you're doing, and anything that I know many Vermonters are trying to offer. Anything that we can do to help you do your job, please let us know. Deb, would you like to offer your final thoughts for our listeners?
Yes, first of all, thank you so much for having me on, and thank you, Dr. Rice, for your insight as well. As healthcare professionals, coronavirus for us has been a moving target as well. We're getting new information from the CDC and World Health Organization and our hospitals every day. So please be patient with us as we all get through this together. Please know that I do not know a nurse or doctor or respiratory therapist or housekeeper at any hospital that does not feel the need to take care and to help everyone that's in our facility, and that we are doing the best we can under these circumstances. And thank you for being patient with us.
We will be patient 100% for all that you all are doing. Thank you, Deb. And Dr. Rice, do you have some final thoughts you'd like to offer?
Yeah, sure. And again, thank you for having me on as well. I appreciate the chance to try to assist in this way as well. I would say to folks, be as productive as you can from the safety of your home. Now's the time to stay home and get all those projects done that are on the punch list from at home. Minimize your social contacts, wash your hands well. Remember that most people have mild disease or no symptoms at all, but can spread it to other folks who are at risk. So really take care of each other in that method by the social distancing. And use your primary care practice or the health department for information if you need it. But also get your regular care as well from your primary care office. They're doing telehealth visits for regular chronic management of hypertension, diabetes, other medical problems, evaluating your medications, that kind of thing. Don't put that off. Get that taken care of because your docs won't have chance for it later. Well,
thank you. That is incredibly helpful. And you mentioned washing your hands, and I meant to ask you each about sort of that protocol. I've learned a little bit watching a lot online. Tell me if I'm wrong, but really spending that full 20 seconds, warm water, soap, get the back of your hand up around the sides of your thumbs. I've even seen videos of people talking about really rubbing your fingers in your palm to get the tips of your fingers and under your nails. Is there anything either of you would like to add on that before I close this out with the washing your hands?
No, you continue to do that. And your hand sanitizer as well. I know at the end of a shift at the hospital, my hands are pretty raw, but that's the way it is right now.
Yeah, the ideal is actually the good soap and water scrubbing and washing, and then the hand sanitizers over the entire surface of your hand, and then disinfectant wipes certainly for surfaces that may have come in contact with other folks touching them frequently.
Great. Well, and thank you, everybody. Please know that you can go to the website I gave earlier, zuckermanforvermont.com, zuckermanforvt.com. You can also, for questions, go to my Lieutenant Governor website, ltgov.vermont.gov, and we will try to get answers to your questions as well. I want to add, you can go to the Vermont Department of Health website, healthvermont.gov. That's healthvermont.gov. They have a very informative page on the coronavirus and up-to-date information. And through there, I believe you can also get information around many of these other topics and questions with links for businesses, Department of Motor Vehicles, the executive order, and so forth. Finally, again, please take care of each other, take care of yourselves. I thought Doctor's comment of take care of those things around your home. Use this as an unfortunate but opportunity to do some of those things. We all have to do our part to flatten the curve, to really reduce the stress and burden on our healthcare workers. These folks are going in every day for all of our health and all of our neighbors and friends' health, and for them as well. Wish them well and send good thoughts because they're going through the same individual stress that all of us are going through, and yet then including bringing themselves straight to the front lines, and they're really our heroes. And our grocery workers are similarly those heroes, keeping food on the shelves and risking all the folks walking by them, any of whom may be an asymptomatic carrier. We will work together to get through this. If you had a question that we didn't have time to get to, I want to apologize. There were so many great questions. We do want to hear from you. If you want to stay on the line for a few minutes after the event, you'll be able to record a message for us. Thank you all so much. Thank you, Doctor. Thank you, Nurse Snell, and good night.
Please press 1 to leave voicemail. Please press 1 to leave voicemail. Please press 1 to leave voicemail.